Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, doing the Leaders of Tomorrow with Ayushi. Ayushi, why don't you go ahead and introduce yourself?
Thank you so much, Call. I'm very excited to be here. So, hello everyone. My name is Ayushi Pandya. I'm an administrative fellow at Guthrie Robert Packer Hospital, that is in Sayre, Pennsylvania. So, a little bit about myself. I completed medical school back in my home country, India. Then I did master's in healthcare administration at Rutgers University, and along with that I was working as an administrative assistant at St. Luke's Hospital, that is in Allentown, Pennsylvania. And I joined Guthrie 6 months before, it is last July. So journey is going so far so good.
Excellent. We're so happy to have you on. I really appreciate you making time to join with your busy schedule. So, tell us about kind of what inspired your journey back in India. What was the reason that you kind of wanted to go into the medical field to begin with?
Oh, that's a really interesting story. So, my parents, they work in the rural hospital, and somehow, as a kid, I have seen them serving in the community, and somehow I inherited those things and values in myself, and and motivated by this, I pursued admission into medical school with aim of making meaningful impact. And I completed my medical school. I was so excited working in the community, but during my internship I witnessed many challenges in healthcare systems, such as scarcity of resources, transportation problems, and all those things led me think on the non-clinical side of healthcare. Simultaneously I moved to United States. I was exploring new avenues those aligned with my life goals, and at that time COVID-19 pandemic occurred, and that further uncovered challenges in healthcare, and I again saw scarcity of resources. So that solidified my intention to work or contribute myself towards non-clinical side. So that is the whole reason and the story of my transition from clinical to non-clinical side.
Excellent, because I know, and I think that's a great story. With how a lot of IMGs they come over from the U.S. and either they have the choice of doing the U.S. residency here and going through internship here, or they have the choice of kind of going another way. But I like how you stayed in healthcare and you kind of
Mhm.
focused on what you saw. Now, when you came over to the United States to begin with, you did do a physician observership, right?
Yeah, I did that observership. It is like to get to know about US healthcare system and hospital structure, how it's operating, so those kind of thing. But it was for like I think 1 or 2 months max. But yeah, I did that opportunity, and it was nice observership in terms
Excellent.
of understanding about healthcare in USA.
And then after that, you started applying for the MHA programs.
Right, that's true.
And then with the MHA programs, how many did you apply to? Was the application process challenging? And then what led you to go to Rutgers?
So I have applied so many programs, I forgot my counting, but yeah, I have applied as much as I could. But I choose Rutgers program because of several reasons. First is was I drawn towards the program's curriculum, which offers like vast variety of courses and emphasize on the development of various competencies, and the program's elective options, those provide excellent opportunity for person to showcase their talent and acquire new skills. So that is the first reason. And additionally the location, the that is like proximity to my extended families, and I heard so many good things about Rutgers University and specific programs, so that solidified my choice. And moreover, during the application process, the guidance and support provided by the student counselor were instrumental, and they navigate me throughout the process. So those are the reason why I choose Rutgers as a why I choose the program.
So it is pretty important then that other programs kind of take note and provide that counseling to students as they're applying for the program, because that's one of the big things that made a difference for you. When you were in the program, do you feel like was there lots of challenges with the US healthcare system that you had to kind of adapt to that were different from the healthcare system in India?
I don't think so because there are so many similarity, but of course, U.S. healthcare system more focused toward preventive care, while Indian healthcare system more focused toward acute care and acute treatment. But I think the Rutgers program did a very great job in terms of giving some overview and how the US healthcare structure and all those things. So I think I didn't have those kind of challenges while pursuing the course.
Great, that's great. And then during your program, you were an administrative assistant at St. Luke's. So tell me a bit about what made you want to choose this facility, St. Luke's, and then also what made you want to be an administrative assistant and how that's helped you kind of for your future roles.
So I was actively looking for other part-time job or the healthcare position where I can see and actually work in the real world and see the dynamic of the administrative healthcare. So I applied multiple hospitals, and fortunately I got chance into St. Luke's Hospital, and that how I started working there. And I feel like that is really great opportunity in terms of even making connections. So I think it's been a great opportunity for me.
Did you make lots of connections that you're still in touch with from your time there?
Yeah, I still touch with them. So Sandy, yeah, if you are listening to this podcast, then she is my mentor and she helped me a lot even with finding this administrative fellowship program. So
Nice. So you kind
yeah,
of made these connections, built these relationships, and it helped you get your fellowship program that you're in now. That's excellent. Very
exactly,
cool.
exactly.
That's really cool. And then, so you are in your administrative fellowship program now. How is that going? Can you tell us about who it's with and what it's like?
Sure. So currently, I'm pursuing administrative fellowship program at Guthrie Hospital, that is in the Sayre. And whoever might not know about the Guthrie Hospital, then it is on the north side of the PA and located like on the border of Pennsylvania and New York. So we have currently six hospital campuses and serving in the New York community as well as Pennsylvania community. So this is like a 2 years program that include first year include quarterly project like in inpatient, outpatient, quality, and business operation. And the second year involves a year long project. So I feel like through this program I had chance to work on different project, and that provides me an opportunity to observe effective leadership skills. And I feel like this experience is very instrumental in terms of fostering independence as my management skill is growing and evolving. So
Now, after your fellowship, do you want to stay with Guthrie? Are you looking to move around? What is your plans post fellowship?
I'm still exploring where I can add, but of course, if Guthrie is offering something, then I would like to stay here because Guthrie is serving rural communities, and I always have a soft corner for the rural communities. So I'm really looking forward to where I can stay. But that is the one of the reason why I apply for the administrative fellowship programs, because I wasn't sure after my master's degree like where what should I can do. And my mentor suggests me to apply for this kind of program. So through the various project I have chance to look into, okay, what is this department doing and how they're structured. So that is the one of the reasons. So I'm literally in the exploring phase of right now. So
Nice. That's really cool. I know a lot of our past fellows have talked about the same thing. They weren't sure exactly what area they've done. What are some areas that you like that you've explored so far?
I like so currently I'm working on quality project and I really like it. So one is healthcare quality, patient experience, supply chain, or the operation. So those are the four areas in my mind. So let's say
Nice. That's great. Yeah, supply chain's an interesting one. I haven't talked to too many people who do that one, so that's really unique. And then of course, quality is excellent. I love quality myself. It's a very, seeing the processes improve and
Right.
the metrics get better is really enjoyable.
That's
With
true.
the fellowship, are you the only fellow or are there multiple fellows?
No, we have first year fellow and second year fellow. So first year, it's usually 3 years or three fellows or four fellows we have. So it is multiple
That's great.
fellows.
And do you kind of collaborate with them? Do you work with them? Are you friends with them? How does the relationship work?
Actually, we all share one office, so it is good. Like we like very friendly. We talk with each other, and second year for fellows, those are mentor to me. If I have any questions or anything, then I can easily reach out to them, and they always guide me, support me. So it's like good culture here.
And you said it's pretty rural in that area, right? So
Right.
how do you like the area? Is it a nice area? You said you'd like to stay there, right?
Yeah, so this Sayre is pretty rural, but there are so many good places around it, like Seneca Lake, Finger Lakes, and there are so many other good cities. Like Binghamton is nearby; it's like 30-minute drive, so that's not bad. Yeah, so there are so many good places here where we can hang around or go. So
Nice. That's excellent. It sounds like a really
yeah,
pretty area as well.
yeah, and there are so many good hiking places as well.
So I'm going to put you on the spot a little bit with this question, but based off your experience in India, your experience kind of in the US so far, what do you think one of the biggest issues in healthcare at large is in the United States?
That's very interesting question. But I can feel that chronic diseases, those are very broad here compared to India. Diabetes is the number one cause of the death in the United States, according to CDC. So I think chronic disease are the number one or leading cause here and more pronounced compared to India. But we are doing preventive care and looking more towards how we can prevent those kind of things. So I think we are working towards it, but that is the one thing that I can see a major gap.
So if we think about kind of the diabetes that you were talking about, the chronic diseases at large being a really major concern, do you feel like your MHA program and your fellowship is preparing you to fix some of these issues?
Yeah, sure. So currently, I'm working. So along with my this administrative fellowship program, I also work with the CHNA, that is Community Health Need Assessment, and we are looking actively looking into the healthcare data. Like, okay, what's the diabetes rate this year? What are the blood pressure rates in the community? So we are actively looking around those areas, and we can also do like meetings and try to reach out to people and see what are the gaps and how we can resolve those or mitigate those challenges.
That's
So
impressive. So
yeah.
you're ready to kind of get out there and you're already making an impact, which is
Right.
great to see that you're not, sitting behind a desk, I guess, but you're actually getting out there. What are some of the bigger personal challenges, if any, that you've faced during your fellowship? And then how have the preceptors or your fellow students help you to overcome them? Some students have said it was public speaking, others have said it was leadership. So what have been some of your struggles?
So sometimes it is hard to reach out to the leaders because those are very busy in their schedule as well, right? So earlier I was only contact them through email, Outlook email. Then my preceptor guide me or suggest me to reach out through Teams or do like Teams call or get back, like get out and just knock their door. So those kind of things are really helpful, like to get prompt response for anything, because emails are like important, but somehow sometimes they are busy and they miss some emails. So that was the one thing that I overcome.
Have you had lots of exposure to senior leadership? Have you met with some of the senior officials at Guthrie?
Yeah, so we have like twice a week, Monday and Thursday, Operation Council meeting, and we are part of them. So we can stay there and see how they are talking and how they are taking decision. So those kind of thing we have chance, and I think those are very instrumental to develop leadership skill.
Definitely. That's it's
Right.
been hugely impactful for me as well as when I can actually see how these individuals interact with each other. It helps me understand how I'm supposed to act. So,
Right. And how
uh,
we can solve those kind of problem. Like if I was in this kind of situation, then how should I take decision and those kind of things.
exactly, exactly. Since you've kind of been, you're very successful. You've had all these successful outcomes. What would you recommend to earlier individuals? If you could kind of go back through the process, all the challenges you've overcome, what would any advice you would give to any graduate students, maybe even individuals coming from India? What would you tell them?
I recommend to do thoroughly research of the program, like any accredited program who provide vast variety of courses and elective programs. So that is very important. Also engage actively in various activities and subcommittees, also in the case competition, attend conference, because those are very important to build network and also develop small leadership skill. Also, if they can pursue any internship or the job that align with their career goals, because those kind of experience will enhance the understanding of administrative dynamic in real world. So I would suggest those kind of thing to anyone who would like to pursue MHK.
Definitely, definitely. You mentioned some of these conferences. What are some of the ones that you've kind of gone to?
I was part of ACHE. So, as a Rutgers University, they all encourage us to be a part of like as a student member, or and they have like I think New Jersey conference as well, New NJACHE, I think.
Yeah, there's the NG ACHE, and then there's the HL, or the Delaware Valley ACHE as well. I'm part of the Delaware Valley one, so the
That's
ACHE is
nice.
great. Yeah, that's an excellent organization. So you got a lot of benefit out of it.
So we got flyers and magazines, and they have like nice articles in it. So they keep me updated with the healthcare challenges. So I think that is very helpful.
Nice, that's great advice. So if anyone is kind of looking at maybe getting involved, then the ACHE would probably be one of your top recommendations.
All right.
That's excellent. So, when you were researching for these programs, and this will be kind of one of the last questions, I don't want to take up too much of your evening, but when you're researching some of these programs, are there any specific tools that you used? How challenging was that search? How long if I was a graduate student or an undergraduate looking to go to grad school, how much time should I set aside for looking for these programs? Months, weeks, what does that look like?
I feel like give like 2 or 3 months to like do thoroughly research, and I also recommend to get some certificate like Coursera, LinkedIn. Those are the nice resources to get like basic certificate about healthcare administration and healthcare safety. Those kind of certificate also helpful to get admission. So those are my recommendation. But yeah.
That's good
Sorry,
advice.
what was your other question? I think you asked 2 or 3 question, right?
Yeah, sorry. Maybe the length, and then how difficult it was, and then you also mentioned kind of with the at bolstering the resume. I think is an excellent tool. When you're looking for a fellowship as well, though, how did you find the fellowship? How did you learn
That's
about it?
that's a really good question, because I was struggling, and I really shout out to Cheryl Egan if she's listening to this podcast, because she really helps me with the whole process. I wasn't familiar with how to apply for even administrative fellowship program, but there is a NAFCAS system where most of the hospitals and most of the programs are in the navgas, and we can apply through the navgas. But every program has little bit different kind of a process in terms of application. But there are two rounds of interviews. If you are selected in first round, then they will give you opportunity for the second round, and that would be in person, so anyone can see the hospital culture and the area around it. So that is the whole process. And for the application, we need a normal resume, personal statement, and yeah, those are the things that we need. So it's pretty simple process, but very difficult to and tiring process, I can
Right,
say.
right. How many programs or how many fellowships, I guess specifically, how many fellowships should potential fellows apply for?
I applied for like 17 program
Okay. So 17
from
is
New Jersey, from New York, New Jersey to North Carolina. I applied for all the programs.
okay. So that's good advice too, because you don't want to only apply for a few and then not get one. And then,
Right.
how many interviews did you end up doing?
I got 8 interviews, and
Nice.
yeah,
That's a really good return rate on applying to
yeah, 50% return rate.
That's pretty good. I know med students they get like a 0.5% or something. So so that's
No,
excellent.
that but I did like very hard work on that. I put whole Excel sheet with whole list of the hospitals, and always making sure if I got interviewed, then write it down if I did call. And I think follow up is important too. Like every time check with the administrator, like, hey, I really like the program, and give a thank you note. Those kind small things, but I think those are really helpful.
Excellent. That's also very, very good advice because that can make the difference between, getting an acceptance or not getting acceptance. I found sometimes not just with fellowships, but also with employment, sending that
Right.
thank you note, following up, kind of learning more about the organization is really important. So really excellent advice you've shared with all of us. I really appreciate your time. Is there any other comments or anything you'd like to share?
No, I would like to thank you for organize this, and thank you for giving me chance.
Of course, of course. I appreciate it. And we hopefully will stay in touch and maybe we'll have you
Sure,
back on in a little while as you kind of progress through your career.
sure, sure.